reached capacity, and they feel that there is a lack of political intervention somewhat. To talk to us about navigating the medical space during a time like this when we are seeing a peak once again, let me introduce my guest now. I'm joined by Dr. Nomthandazo Dube, who is based in Pretoria, that's in the Gauteng province where I am as well. Dr. Pinky Ngcakani, who works at the Life Mercantile Hospital, that's in the city of Gqeberha, that's in the Eastern Cape province, and Dr. Fazleh Mahomed in Newcastle, that's in KZN. To all three of you, a very good morning, and thank you indeed for making time to talk to us here on Newsfeed. Let me start with you, Dr. Fazleh Mahomed in KZN. Can I just ask all of you whether you have been affected personally by COVID-19? What I mean by that is that, have you contracted COVID, and what was that experience like, or possibly a family member? Just describe that for us.
For me, no, I didn't contract COVID, and none of my close family members.
So you've contracted COVID-19 and you've lost family members as well?
No, neither.
Neither. Okay. All right. Thank you for clearing that. I thought I'd heard you incorrectly indeed. Let me come to you, Dr. Nomthandazo Dube. Any experiences with COVID-19 at a personal level?
Yes, I contracted COVID-19 in July of last year. Ended up on a ventilator for about 5 weeks.
Sure.
I went through everything. I had the most severe form of COVID. So I had your kidney failures, I had the lung collapse, I had your blood clots, I had, I left ICU, went to rehab, was readmitted to ICU because then I had pus in my lungs, which is empyema. I had liver, my liver bled, so I had a liver hematoma. I was in a wheelchair. I had to relearn how to walk. I had to relearn how to do everything. I was admitted for 3 months and eventually discharged from the hospital in October last year. And then it took another 6 to 8 months for me to have rehabilitation as an outpatient, and only started going back to work around April this year. So I was very personally affected.
You should see, I know you can't see your compatriots, if I could call them that, but their faces, they just... Let me come to you, Dr. Pinky Ngcakani, in the Eastern Cape. Any personal experiences with COVID-19? I mean, Dr. Nomthandazo's story is just frightening.
I had COVID in June last year, but my story is not even half as bad as hers. Shame. I did not even need to be admitted to hospital, even though I was at a point thinking and pondering on being admitted, but I really decided to not be admitted. So my story is really like a small thing compared to what she went through.
Yeah, mild symptoms is what perhaps you are describing to us. Let's come back to you.
I had let's say moderate symptoms, but at least not warranting admission.
Yeah. Well, that's good to hear. Let's come to you, Dr. Mahomed, in KZN. In which or in what facility are you working? Are you in a public facility or do you work in the private sector? And what's that situation like right now as the country finds itself once again battling yet another wave?
I work in Madadeni Hospital. It's a regional hospital in northwest KwaZulu-Natal. The epidemic is starting to pick up. We're starting to see a lot more cases now, especially in this week. And across the spectrum, mild to moderate. Some are really severe, critically ill as well. It's definitely pushing up this week.
Yeah, and what about resources? Is everything available for you to handle this? I'm talking about personal protective equipment.
We've got adequate supplies of PPE. In terms.
All right, Dr. Mahomed frozen there for a moment. Dr. Nomthandazo Dube, let's come to you. All right, apologies. Well, you broke up a little bit there. Just to complete what you were saying to us, Dr. Mahomed.
Yeah, now in terms of space and resources, we've got quite a bit of experience now. So we've discussed preparation for the third wave, and we've set up as far as we can. Our main difficulties are actually getting specialized trained staff for high care areas as such, especially nursing staff. They're in very short supply. But in terms of organization and where to move patients and suspect patients, we've already had quite in-depth discussion and preparation for that.
Yeah.
So we're as ready as we're going to be. We just hope that we don't get overwhelmed by the sheer numbers of the third wave.
All right, we're going to take a short break. This is Newsfeed. We are in conversation with 3 doctors in 3 different provinces. They're telling us their story right now, their experiences at a time like this when the country once again finds itself engulfed with COVID-19. Dr. Dube, let's come to you in Pretoria. You're in the Gauteng province, exactly the same province I'm in. It's a difficult one. We have not seen something like this, and the authorities, the way they're describing this situation, it just sounds insurmountable. The kind of support that you have there right now, how would you describe it?
Okay, so the numbers are definitely picking up. We're starting to see, we're starting to get a lot more admissions. And as Dr. Mahomed has said, we're as prepared as we will be. We're using our experience from the previous 2 waves, and obviously, over the year of having just over a year of having COVID, and that's as prepared as we can be. We take lessons from the previous 2 waves, and we're short-staffed. We can always use, extra hands, etc. We can always use more experience, people that are experienced in the treatment of COVID. So, and obviously we can always use the help from the public, to try and prevent the spread of COVID so that we don't become overwhelmed.
Yeah. The facility you're working in, as I understand it, Dr. Dube, is the George Mukhari Hospital, and that's where you are based. Okay.
Yes,
and
so
go on.
So I work in 2 provinces. I work in the Gauteng province at Dr. George Mukhari Academic Hospital, which is a public hospital institution. And then I also work in the Northwest province in the private sector. So I sort of get to see both sides. Yeah.
Dr. Ngcakani, let's come to you in the Eastern Cape. Previously, you have been a flashpoint, or what usually is called the hotspot. The kinds of lessons that you have learned at the time that you were overwhelmed by the COVID situation. Take us back to that period. What was that like?
Yeah, that was overwhelming, to be honest, because we found ourselves like soldiers going into an army without the relevant and the correct artillery. So we had to wait for information from wherever we could glean. And normally when we have flu epidemics, for an example, or when we have a flu, just any flu, we used to rely on the Northern Hemisphere for their patterns, and then we gain whatever information from the Northern Hemispheric colleagues. But this time around, even though the Northern Hemisphere was the start, but that's where everything started, the information was trickling down very slowly, and whatever attempts were made by the people in the Northern Hemisphere were not that significant. Because by the time it came down to South Africa, Italy was still in trouble. Spain was in trouble in the first wave. But over time, the zealousness and the commitment of doctors, clinicians, we started finding solutions or trying to find solutions. So we got the WHO, which was trying, to be fair to everyone, the WHO tried what it could, but then it's doctors, and they were all working together at the speed of the virus, or even lagging behind the virus for that matter. But then we need to remember that WHO people are specialists like other specialists that are not necessarily within the WHO. So we have to find answers from within and from without the WHO. What was working wherever it was working.
Yeah.
So we did try remdesivir. We tried all the armaments that we could get hold of initially, up until we were finding that we were losing the battle right in the middle of everything. So for me, the breaking point was when we started hearing about, for an example, about the Malaysian experience. They were talking about artemisia, and it didn't look like it was going to amount to anything, because even down here in South Africa, we tried our Afra equivalent, which was Musonyane to be exact, which did not work. I mean, patients were trying it by themselves. It did not do much. But then the break point for me was when we started hearing the word ivermectin. That's when we started having hope. And then the FLCCC started, coming up with information that I felt was more equipping and more promising, which we still, the jury is still out there that ivermectin is probably one of the drugs that we can use. All we want as doctors is for patients to not die. If people are going to die, let them not die young. Let them not die in numbers. Let us be able to manage the numbers that we're confronted by every day. And for the first and second waves, we're really in dire straits. We're battling. And I wish that we have learned something about the second wave, especially from the second wave, because that was, for me, for us in the Eastern Cape, it was worse than the first wave. Because in the second wave, people were dying in numbers. It was families that were dying, couples were dying in numbers. So I wish we have learned something, and we are willing to try whatever it is that we can get our hands on. We want to try whatever medication. So if to me you tell me today that there's something that is promising, whatever that can target the pathway of the virus or the immunopathogenesis of the virus, I'm willing to try, because ultimately we have a pandemic. We are not going to become comfortable to watch people dying, because that's not natural.
Yeah.
So the quest of any treating physician is to make sure we find something up until we can be, at least we can get a hold of it, get a hang of it.
Yeah.
It's very frustrating. It's very frustrating.
Dr. Mahomed, you've mentioned that you work in a regional facility in the area of Newcastle. Any difficult situations that you have had to handle or come across during the first and second waves? What kind of experiences are those?
I think for the first wave, we were all fairly unprepared. It's a new disease. We didn't know what to expect. A lot of the staff were terrified. And there were just a small group of really hardcore medics and nursing staff that were willing to take it on. So the psychological barrier in the beginning was quite an issue. Psychological issues for staff, burnout is a real issue. People worked very long hours, and they were scared to be in contact with their own families. Even something simple like doing grocery shopping and that, that had to wait, because the priority was to do the work and get that done. A lot of the psychological problems that the staff are facing now, anxiety, and that's still ongoing. A lot of depression, post-traumatic stress disorder. A lot of staff have had family pass on.
Yeah.
And it's quite tough to have to deal with that and come to work and deal with multiple deaths every day.
Yeah.
So it's been quite tough for the staff, I must say.
Dr. Dube, as we taper down in this conversation, I'd like for you to point out two areas for me. One, vaccine availability. What is that like at the moment, particularly at the institution where you work? But secondly, difficult choices. We heard Dr. Ngcakani talking about how we cannot let people die young. We've heard stories about doctors having to make difficult choices where you're playing God, choosing to let go of an elderly person in favor of a younger one. What choices are you faced with at the moment?
So, in terms of vaccine, we were a vaccine center, and when the whole Johnson & Johnson when that story about the blood clots with the Johnson & Johnson vaccine, we shut down. And so it's been very slow going back to becoming a vaccination center again. So that's slowed down quite a bit. But I'm sure that will be taken care of in the next couple of days, couple of weeks. I was one of the lucky people that were able to get the vaccine, almost in the first 2 weeks of vaccinations being open. So I think that's one of the most important things, speeding up the vaccination or the rate of vaccination. In terms of making tough choices, look, as doctors, it's something that we've always had to do, probably because of the limited resources. I can tell you it's not easy. It will never be easy. And unfortunately, we're working with a limited number of resources. So I cannot tell you that it's an easy decision to make. And psychologically, it's a very, very difficult thing. Yeah. I don't even know how to describe it. Yeah. You're sitting there, you're faced with the resources, you have to make the decision, and it's a decision that you have to live with as well. And also you also, the reality is these are the resources that you have, and you don't have any other choice. But it will never be an easy decision. The oath that we took says first do no harm, and we try not to do harm at all. And losing a patient is the worst thing ever.
Dr. Ngcakani, you get to have the last word. Frustrations, quickly in a sentence. Are there any right now from your endpoint?
Frustrations, I think the one thing that frustrates me the most is that we're not communicating. We're not communicating together as doctors in South Africa, and we are not gaining our own South African experience. We're not recording it. We're not pushing the boundaries and sitting at the envelope, at the front of the envelope, to try and define for ourselves without having to wait for people outside of South Africa to tell us how to do whatever we need to do. We've got academics in South Africa. We've got professors at all the institutions. I think if we don't get to understand the relevance of science and our medical schools in producing knowledge and solutions for our land, and compare it with other people's knowledge, and instead of just waiting to be babysitted by other people, that for me has been one of the greatest frustrations.
Thank you very much for those inputs and indeed sharing your experiences with us. Dr. Fazleh Mahomed, Dr. Nomthandazo Dube and Dr. Pinky Ngcakani, thanks indeed.